Microscopic Urinalysis Lecture. Introduction to Urine Microscopy, which is the examination of the urine sediment. It includes all solid materials that are normally suspended in urine. The solid material in urine specimens can be identified only by microscopic examination. Microscopic urinalysis is used to identify and quantitate formed elements within the urine. A microscopic exam may be included on all urines, or when we are looking for something that was positive on a chemical reagent strip. So methodology, we are testing the concentrated portion of the urine. It is a standardized procedure, and we use NCCLS guidelines, which include in the exam 10 to 12 milliliters of urine, a 5-minute centrifuge, approximately 20 uroliters of sediment is examined, and a standardized report format is used. So we need to pour into a tube 12 milliliters of well-mixed urine and then centrifuge for 5 minutes. And then we get the supernatant and the sediment. We would then decant off or pipette off the supernatant and leave the sediment in the bottom, which usually is about 1 milliliter. Since urine has a low refractive index or is light in color, an unstained sediment might be difficult to examine. So we use the Sternheimer-Malbin stain, which differentiates cellular elements, such as red blood cells from yeast. In urine microscopy, we use subdued light, fine focus, low magnification, meaning 10x, and then we go to high magnification, meaning 40x. We report as an average per field, and we correlate the results with physical and chemical findings. Some things that we will find in the urine sediment are cells, casts, microorganisms, and crystals. Sediment constitutes our red blood cells and white blood cells, which are typically abnormal in the urine sediment, epithelial cells, which can be normal. Casts, hyaline casts can be normal in small amounts, but cellular, granular, waxy, and broad casts are abnormal. Bacteria, there can be a small, minute amount of bacteria depending on the collection method, but typically high bacteria is abnormal. Yeast, Trichomonas vaginalis, sperm, mucus, crystals, meaning abnormal and normal, and artifacts can also be found in the sediment. Red blood cells, or RBCs, normal, there are 0 to 2 per HPF, meaning high power field, or 40x. If there is an abnormal amount, we call this hematuria. Red blood cells can be either crenated or swollen or ghost cells, and this is highly dependent on the specific gravity of the urine. Crenated cells are from hypertonic urine, meaning high specific gravity, and these red blood cells are oftentimes shriveled in nature. Swollen or ghost cells are hypotonic or low specific gravity, and these can be overinflated red blood cells. Here's a picture of what red blood cells look like. They are generally quite small, and as you can see, they are concave in shape and have a little indentation in the middle. And this is on a higher power field. On a lower power field, they will look completely flat. Here's another picture of red blood cells. Note the concaveness of the cell and the shape. And red blood cells can have various different shapes, but we oftentimes look for that concave shape. White blood cells, or WBCs we also call them, clinical significance is 0 to 2 leukocytes per high power field, meaning 40x. An increased number, we call this pyuria. And if there are clumps of red blood cells, this is an indication of infection. There are different types of white blood cells. There are polymorphic neutrophils, and then there's mononuclear white blood cells, which we often call lymphocytes. And then we also have what are called glitter cells, which are swollen white blood cells. And these happen in hypotonic urine, which means a low specific gravity and also an alkaline pH, meaning below 7. White blood cells will oftentimes have a granular appearance and sometimes a nucleus. Here's an example of the granulation in the white blood cell. Here's another slide of white blood cells. You can see the granulation in here a little bit, and here's a clump of white blood cells in this slide. With white blood cells on a slide, you will also almost always note the presence of bacteria also on those slides. So here, these little dots, little slits, are all bacteria that are in the urine. So they are all over the place generally when white blood cells are present. So here are some more examples of white blood cells. So granulation, here are some with the nucleus that you can see. Note the size of the white blood cell and how big it is. White blood cells are many, many times bigger than your red blood cells. So this white blood cell is huge, and then here you have a red blood cell. So note the difference in size between the two. Also, the red blood cell, note the concaveness of it. White blood cells do not have that. Epithelial cells, clinical significance derived from the lining of the urinary system. There are 3 different types. Squamous is the most frequently seen and the least significant, and this is just from the lining of the urethra typically. However, if we're doing a midstream clean catch, when we have the patient go to the bathroom, the first portion goes into the toilet, that sometimes will rid some of the squamous cells so they are not as frequently present in the microscopic examination. Transitional originate from the lining of the renal pelvis and clinically not significant unless they are found in large numbers. This can be an indication of renal failure or dysfunction. Renal tubular epithelial cells are slightly larger than white blood cells, and increased numbers indicate tubular necrosis. Chronic kidney disease is typically the cause of these in high numbers. So here's what a squamous epithelial cell looks like, very rigid in edge. You will see a nucleus. They don't have really any defined shape, so to speak. They can all be a little bit different. Here you have some transitional epithelials, and you'll note that the lip of the transitional epithelial, and sometimes they will have a flattened edge, and then a nucleus. And then we have a squamous epithelial cells and then some renal epis here and some squamous. And then here are some more renal epithelial cells. And note that they are pretty regular in shape.